sound for me okay? Welcome to the stream. Johns Hopkins University has been keeping track of the global numbers for COVID-19. Let's have a look here on my laptop. It is difficult to get accurate figures, but this is what they are seeing roundabout now is 5 million confirmed cases. Look at the number of deaths here. And we are going to be talking, though, today, not about deaths, but about remarkable survivors, as survivors come from the US, from the UK, and also from South Africa. I am going to get them to introduce themselves to you. Hello, Naledi. Welcome to the stream. Tell everybody who you are.
Hi, Femi. Thanks so much for having me. My name is Naledi Khatebe. I'm a lifestyle content creator and an ambassador for a national agency called Higher Health, which works in conjunction with the Department of Higher Education and Training on topics of COVID-19 and spreading awareness amongst the youth.
And the most important fact for today's show, you are a
COVID-19 survivor.
Mm-hmm. Thank goodness for that. Hello, Dr. Zoe. Welcome to the stream. Tell everybody who you are.
Hi, thanks for having me. I'm Dr. Zoe Williams. I'm a GP working in the NHS here in London in the UK. I also recently worked in the Nightingale Hospital, which was one of the new temporary hospitals set up to treat COVID patients. I have a few other roles as well. I work with Public Health England and the Royal College of GPs, and I also am a COVID-19 survivor.
So happy to hear that. Jason, hello. Welcome to the stream.
Thank you. My name's Jason Hartilius. I'm a TV producer. I live in just outside of Philadelphia, Pennsylvania in the United States. I am a COVID survivor as well. I'm on day 68.
Good to have you. Jason, I feel one of the best ways to explain or to show what it might be like to have COVID-19 or what it was like for you is just to show some video of you coughing. Here we go.
So I'm in the middle of one of the breathing, almost coughing attacks I get for a few minutes at a time. It feels like I can't breathe. And the deeper the breath is I take, the more it actually hurts. So hopefully this only lasts a few minutes. Saturday afternoon, May 21st, March 21st, about 4 o'clock.
Jason, give us a bit more context. We can tell it hurts just from that video. But where were you in your COVID-19 journey?
So that was day 4. I was still home at that point. That was only a day after I started experiencing shortness of breath. And it got much worse than that. That was day 4, and I didn't go to the hospital until day 7. So when I was experiencing that, I would get these attacks where it would come on and I could feel my lungs all of a sudden didn't want to work. And it would last 5-10 minutes, sometimes a half hour, and then it would go away for an hour or two and I'd feel okay. And I think maybe I don't have it that bad. And as the next couple of days went on, those attacks kind of got closer together until I was just like that all the time. And we got to the point where I had to call the hospital, got an ambulance ride to the hospital. And as soon as they put oxygen up my nose, it was a huge relief. All of a sudden it felt like I could breathe again. But yeah, it was pretty scary not being able to breathe and wondering how long those attacks were going to last.
Naledi, when did you realize that you probably had COVID-19?
So thank goodness, Jason, I think what he's gone through is very intense. I was a lot more asymptomatic, but I did have a very distinct symptom, which was difficulty breathing. I woke up on March 15th in my cousin's bed in London, and it felt as though I had something sitting on my chest, as if my completely restricted, like I couldn't draw a breath of air. And I think it's so significant, that feeling, because it's not something that you've ever had before. You can't say, oh, it's a bit of a cough or it's a bit of a sneeze here and maybe chalk it off to something else. When you can't breathe, you start to realize that something's not right. So, I mean, from then on, I immediately self-diagnosed and convinced myself that I was sick with COVID-19 before I'd even tested, but I tested the next day, fortunately. But then I waited for my results for over a week anyway. But yeah, that first symptom was very, very significant for me.
There's something not right. You describe really well. You describe it as you know your body. So if your body starts doing something that you don't usually experience, that's a sign.
Exactly. That's it. You know when something is completely off, and that was what was so interesting when I tested and when I went to my doctor and he checks my vitals, and my oxygen saturation is perfect, and he checks my temperature, no temperature, and he checks my chest, his stethoscope to hear if there's any kind of a crinkling sound in my lungs. Absolutely nothing. And so he's having to go off my word. And this is the beginning of the pandemic. It just been announced. And I don't think anyone at that point really knew what to make of it. So at that point, everyone thought I had late onset asthma at the age of 29. And so I'm having to explain to everyone, this is not it. I know something's wrong. You have to let me test. Fortunately, I'd been traveling, so they did give me permission to go test for COVID-19.
Right. The fact that you flew and you had COVID-19, it just gives me chills. I'm going to come back to that because people are thinking about how dangerous is it to travel right now. And you flew from the UK to South Africa with COVID-19 symptoms. So who knows what went on in that journey? Goodness me. Dr. Zoe, you must know exactly that you had COVID-19. Was there any confusion about what you had?
It was, for me, it was quite instinctive. And it, again, similar to these guys, it was probably around the same time actually as Jason. It was Friday the 13th, I don't know if people are superstitious, of March that I first developed symptoms. Just felt a little bit unwell, a little bit headachy and a bit fatigued. And the following day, I saw my family. I saw my dad, my brother and my nephew. And it was very instinctive. They went to hug me and I just said, no, I don't feel very well. I'm sure it's nothing. I'm sure it's not the coronavirus, but there's something not quite right. So just don't come too close. And then I went to play football with my nephew. And just normally I've been around with him for hours. After about 10 minutes, I was completely exhausted. Came back to my family and I knew I needed to go home, and then slept for about 20 hours. And that was the start of the illness for me. So very much like Naledi said, just really felt not right and something very different to what I'd ever had before, which was suspicious, and didn't get tests because we weren't testing at that point here in the UK. So just self-isolated based on my symptoms, but luckily didn't require hospital treatment or wasn't as severely unwell as Jason was.
Jason, when did you get a test? When did you know for sure?
So my first symptom was a fever. I woke up from a nap with a fever of 102.6. That was Wednesday, March 18th, so not long after Dr. Williams. And at first it was just a fever. I actually called my doctor's office. It was after hours. They got right back to me and they said, if it's just a fever, don't worry just yet. You don't need to go to the hospital or rush anywhere for a test. Just isolate yourself in your bedroom and see if anything else happens. And it was 2 days later when I started to notice I was having shortness of breath. I had a little bit of a cough. And people talk about the cough. For me, the cough was almost more of a gasping for air than your traditional cough when you're sick. So that was the third day. So that would have been March 20th. I went for my test. And then I was in the hospital the next week for 3 days. And what's wild is my test results didn't come back until I was already out of the hospital. So I was in the hospital for 3 days, and the doctors were treating me as a presumed COVID case, but they didn't really know for sure. It wasn't until the next day that I got the phone call. The process has gotten a lot quicker since then, but I know that was frustrating for all the doctors who were working on me, especially when it comes to trying to figure out what medications to use, because they really had no idea. They were essentially guessing and told me they were guessing. So it was a long wait. That was a really long wait to get that phone call.
I'm noticing that all three of you COVID survivors talk about dates, and you remember the dates, the days very, very clearly. Asma here on Twitter, Asma Ahmad, asks, what are your memorable, unforgettable moments? Dr. Zoe, from this disease, what will you never forget?
So, do you know, it's kind of the guilt that comes with it, having had symptoms very early on. So 2 days later, I was convinced this has got to be COVID. And I really had to retrace my steps and thinking and waiting to see are my family going to get this? Are they going to be more unwell than me? Is my boyfriend going to get it, who I live with? He did get it, and he actually got it much worse than I did. Thinking back to the patients that I'd interacted with in the preceding days, and when I was able to go back to work, looking at their notes and thinking, have I given this to anyone? As far as I could trace, the only person who I gave it to was my boyfriend, and he was fine. He's made a full recovery. But that, for me, is unforgettable, just thinking, have I given this to somebody else, and have they, have they been very unwell with it?
And everything's fine with your boyfriend, Dr. Zoe. You're not in trouble.
He's absolutely fine. I didn't make me look after him. He kind of dragged it out for a little while, but yeah, he's fine.
All right, Jason. A moment you're never going to forget.
The one moment that I'll never forget was walking down the stairs of my house when the ambulance got here. They actually asked if they needed to come get me or if I was okay to walk down the steps. And I told them I'll come to you because I didn't want to make the technicians on the ambulance come into our house with germs all over it. And I walked down the stairs. I had to stop about halfway down the stairs and take a break, take a deep breath, which was hard. And then I got to the bottom of the stairs and looked out the front door, and there's an ambulance at the end of your driveway for you. And that is a scary sight when, I'm otherwise healthy. I have no conditions that really should have put me at risk for this. So I'll never forget that. And then I mentioned the stairs. Then I spent 25 days in isolation, 3 days in the hospital plus 22 and change at home. So I spent a total of 25 days in isolation, and I came back down those stairs. When I came out of the room, it was like I had been away for years. That was something I'll never forget, walking down those stairs. It was like the world had passed me by.
Now, Lady, you showed us some of your videos of you taking care of yourself and recovering. So one was breathing exercises. So we're going to share that with everybody. It's just a couple of seconds long, but what is going on? You seem to have a tube in your mouth. And we'd like to share that.
Right. So it's a kind of, I got it from my uncle. He had lung issues, and essentially you have to hold your breath for as long as you can to get your lungs as strong as possible. So you have different ways. It's either to inhale for 5 seconds holding it, or exhale for 5 seconds. It's kind of like, it's really for recuperating more than it was in the middle of the whole thing. But my family was really insistent that I took a very active role in my recovery. They didn't want me to sleep or relax while I was getting better. That was the greatest fear, that I might, kind of fall asleep and kind of never wake up. So everyone's constantly on my case. Get up. No, you've got to do this exercise. You've got to breathe this way. Get your humidifier. How are you feeling right now? And I really think it was that active role and constantly being aware of my body that was super helpful in the process of recovery. And just to touch on, sorry, if you don't mind me saying, just to touch on your point about the guilt, Doctor, it was literally one of the most significant things, was that level of guilt, who you might have come across, who you might have contaminated. You don't know how it moves or what the process is, and it's just that when you're sitting there thinking about your family and all those people that you could have possibly exposed, that's probably the most significant feeling out of everything that you actually felt physically, for me at least.
Dr. Zoe, got a question for you, and this question comes from our online community. So I'm going to show David Latt. This is David Latt. He was actually on a ventilator as he was recovering or being treated, being looked after, because there isn't really any treatment for COVID-19. So this happened on April the 1st, and he'd been on a ventilator for 6 days. And on April the 1st, he was discharged. So he's looking happy, but a little disheveled here. But he also has a question for you, Dr. Zoe. Let's have a look at David Latt's question.
My name is David Latt, and I am a survivor of COVID-19. It has been roughly 2 months since my release from the hospital where I was treated for COVID-19. I still have a cough, I still have shortness of breath, and I still have a slightly hoarse voice because of damage to my vocal cords when I was on a ventilator. I'm doing a lot better, but my main question is how much of my impairment right now is going to be permanent and how much will improve. This is the type of question that many of us survivors are grappling with. Will we ever return to our old selves?
Okay, I think I kind of have a two-part answer really for David's question. And anybody who's ever had any illness that requires going onto a ventilator, anybody who's been unwell to that extent, it depends on the illness that they've had, it depends on their own circumstances, but they must be followed up by a healthcare team, because having been on a ventilator, having a ventilator breathe for you and having organ failure can have repercussions, and some people will make up a full recovery and some people may not. And the way that this disease affects the lungs, it causes inflammation in the lungs. It's caused by your own body's immune system. Now that can lead to some scarring. I have to be honest and say, I don't know. In fact, no doctor knows what the long-term consequences of having COVID will be, because we're not there yet. But even people like myself who didn't require ventilation and had a relatively mild illness, we're hearing lots of reports of people having what's sort of being named post-COVID syndrome, where it's just taken an unusually long time to fully recover. And what's really unusual about it is, although other illnesses might take a long time to fully recover, we tend to see a gradual improvement. Whereas with this, a lot of people are reporting that they feel somewhat better, and then for the next 2 or 3 days, they feel very fatigued and short of breath again and getting a cough back again, and then they feel better. And you know, we need to just really need to wait. But my advice to David would be, or anyone who's been on a ventilator, like that is really, really significant treatment, and you will likely need to have some follow-up and some checks following that with your team.
Jason, this has to resonate. Just picture of you here going back into hospital. Can't get enough of this place. Still got a sense of humour. The good news, I'm fine. You don't look that well, Jason, but this is after you recovered from, recovered, in air quotes, recovered from COVID-19.
Yeah, so that was day 51. So I got out of the hospital. I was in the hospital on days 7, 8, and 9. I came out of isolation on day 25, and somewhere in about my 5th week, I started noticing a shortness of breath creeping back. I had been really tired for several weeks. I spent 2 or 3 weeks doing almost nothing but sleeping, and I know a lot of people say you should try to get up and move around. I couldn't. I didn't have the energy. And in about the 5th week, I started experiencing shortness of breath again. And then one morning, I woke up with a really bad pain in the back of my shoulder, like right here, and I just thought I slept funny. And as the day went on, it got worse. And then over the next day, I kind of felt it creep into here, like into my chest. And then I felt it kind of come into the center of my chest. And then I started feeling a sharp piercing pain in my lungs when I would breathe. And I called my doctor, and they told me they wanted me to go to the emergency room to rule out things like blood clots, potential risk for a stroke or a heart attack. And I was diagnosed with pleurisy, which I'd never heard of. But it's a condition, just like Dr. Williams was just talking about, where the inflammation in your lungs is so bad. The way the doctor explained it to me, there's a lining on the outside of your lungs that should be like silk. And as your body moves, they just kind of glide against each other. And mine were so beat up, the way he explained it was, it essentially was sandpaper rubbing together. And those sharp pains were from every time I would move. And it definitely got worse when I would move. Every time I would move, I had this incredible pain in my chest. And I have no history of heart problems. I had a couple heart tests just a couple years ago. It was all clear. So I'm not used to dealing with stuff like that. So having, not being able to sleep and sitting in your bed at 4 a.m. because you have these sharp chest pains is a very scary experience. As a result of going back to the hospital, I've now seen a pulmonologist. I got to go get a checkup on my lungs. I also just had an echocardiogram just a couple days ago, and that showed up clear. But as the cardiologist said, something we didn't really expect to see, we're seeing patients in their 30s and 40s who didn't even have COVID all that bad, but weeks later, after they thought they were recovered, they're experiencing things like blood clot, strokes, and heart attacks. So we want to take a look at your insides to make sure you're not at risk for that. And that was really scary to hear. And again, I thought I was kind of getting better when this happened. And I ended up back in the hospital on day 51. It was 2.5 weeks ago. They gave me some good drugs and I was out of it, a few days later, but it was scary.
Listening to all three of you, I feel that you are all case stories. Your how do we know more about COVID-19? Every one of your stories is teaching us something. This is Fiona Lorenstein. She set up a survivors group, and she said, my most important medical support right now comes from other survivors. This is what she told us earlier on the stream.
I think support groups like the Body Politic COVID-19 support group fill information gaps in a couple of different ways. So first, they help patients connect and validate symptoms that may not be widely known. The CDC list, is being updated, but not necessarily at the rate that people are experiencing these symptoms. Secondly, they allow people to compare global recommendations. So we're able to talk about what the NHS is saying versus the DOH. And thirdly, they help marginalized populations especially kind of empower themselves from a patient's perspective, learn to be their own health advocates, and also arm against medical bias. And those are conversations we have a lot in the group that are tangibly helpful conversations that allow people to better navigate the medical system.
Do you feel like a resource now, Naledi?
Yeah, definitely. I think especially...
Yeah.
I think especially amongst the youth, it's kind of really important to have these kinds of conversations. Africa is a continent that demographically is made up in larger part of the youth. We are the mobile carriers. We're going to be the ones that move around and carry it. And a lot of us are going to be asymptomatic. And so it's been really important for me to have these kinds of conversations from kind of like dispelling conspiracy theories, which was a huge thing in the beginning and probably the reason why I too didn't take it that seriously, but also just sharing from an experience point. Like, I think people can hear a lot of information coming from all kinds of directions, but when you hear it particularly from somebody, and especially somebody that you might relate to, it's so much easier to swallow that information. And so I think that's just been a really important thing that's kind of come out of this for me, is just having those conversations constantly with everybody.
I'm just looking at Capano on Twitter, and Capano asked, what kept you in hope so much that at the end of this dilemma, he calls it, you believed that you would beat the disease? And also, what advice can you give to the victims of COVID-19 who are struggling with the disease in hospitals that can give them hope? I'm going to make this a speed round. Dr. Zoe, you're in a good position to be able to tell people. I mean, it's a mood question. It's like, how do you keep it together?
I mean, I think if I speak about this personally, I have to say, I felt unwell, but at no point was I fearful for my life. No point did I feel that I would require additional help from healthcare services. I did have what most people actually do have, which is a mild to moderate illness that just seems to take a very long time to get better. I think the main thing to bear in mind for people who do have a more severe illness, it can be a bit dangerous because there's all this battle talk. There's a lot of talk about like we're at war and, if you're strong and if you fight, then you will beat this. And I think that can be quite difficult for people to hear. And I'm sure Jason can elaborate, because actually it doesn't come down to a battle of your will against the virus. At the end of the day, this unfortunately affects some people in extreme ways, and for the people like myself, we're quite lucky.
We've got 90 seconds left. I want to squeeze in Jason and Naledi so they can say what helped them, what kept them together, what hope can you give? Jason, you know what 90 seconds is like. You don't have all of it. I'm going to give you 45.
All right. So I tried to stay as positive as I could in the hospital. I am a former TV news producer. I had to stop watching TV news because I just kept seeing the death toll. I kept seeing these stories of people who were healthy and 2 days later they were dead. So I had to stop watching the news. I also read a lot of stories about people who were leaving notes and videos in their phone for their loved ones in case they died. And I was never seconds away from death, but there were definitely moments where I thought to myself, am I going to get out of here? And one of the things I remember doing is deciding not to make any videos. I made videos kind of documenting my experience, but never actually made any videos saying goodbye because I didn't want to concede, hey, this might take my life.
Naledi, I'm going to give you one sentence to wrap us up with for now.
Sure. I mean, it's a mental game. You just have to convince yourself that you can push through it. I think that's the most important thing. It's just telling yourself it's
possible. Naledi, Dr. Zoe.
Yes.
Jason, thank you so much. We now know that it is possible. And of course, we know it's possible to survive COVID-19. Thank you so much for being with us. And I've just got time to tell you about one more thing that we're doing regularly Sunday through Wednesday, and it is the AJ Stream Instagram Live conversation. So much more to tell you about behind the scenes on AJ Stream, Al Jazeera, and each episode. And that is at 16:30 GMT, Sunday through Wednesday. See you on Insta. Thanks so much.